I want to ask a little bit more about that because the last time you were here, you had expressed some concern that there could be a significant number of delayed screenings, and then that could result in, I think, 10,000 undiagnosed cases. I'm sorry if I'm misrepresenting that. How has that panned out? Have your fears manifested? Has it been more or less than you expected? But what has been the impact of delayed screenings during the pandemic?
Right. So you're alluding to some modeling we did early on in the pandemic, within months of it starting about what would be the impact if, people stopped getting cancer screenings and stopped getting routine cancer care. And we made some what we thought were like kind of worst case assumptions, like maybe we reduce mammography by 75%. And it turned out that most of our worst case scenarios were low balls. It's actually worse than we expected. So we've seen across the board, 95% declines in various kinds of cancer screening, mammography, lung cancer screening, colorectal cancer screening, and pap smears for cervical cancer. And we've also seen delayed diagnosis. So patients, the incidence of diagnosis of cancer has declined sort of for a couple of months during the pandemic by 50%. There's no reason to believe true cancer incidence went down by 50%. We think that's just people who weren't going to the doctor or weren't getting routine care. And we believe many of those cancers are just going to be diagnosed now at later stages. So I think the worst fears of the NCI were confirmed. And now we're seeing that clearly in the data. But what we don't know yet is what this is going to turn out to in mortality. If this is going to be lead to adverse outcomes for patients. And I think there has been this real collective action by the cancer care community, by hospitals and societies like the American Society of Clinical Oncology, the American Cancer Society, and caregivers and patient groups to really try and galvanize, work together and make the impact of the pandemic as least bad as possible. So getting patients back for screening, getting care back on track. And so we will have to see over the next, it'll take, years, perhaps even a decade to really understand the impact of the pandemic and these delayed screenings on cancer mortality. But we definitely have seen a bigger impact on terms of screening and care than we expected at the beginning of the pandemic. And as I said, we thought those were sort of worst case scenarios when we modeled them.